Today I will be discussing about specialized techniques for imaging in dentistry. Conventional tomography. It is a specialized radiographic technique developed originally for producing radiographs that showed only a section or slice of a patient. A useful analogy is to regard the technique as one that enables the patient to be imaged in slices, like a loaf of sliced bread. So here in figure 12.1, it is the diagram illustrating the analogy of tomography. The patient is imaged and can be viewed in slices like a loaf of sliced bread. Each individual tomographic image or slice shows the tissues within that section sharply defined and in focus. The section is thus referred to as the focal plane or focal through. Tissues and structures outside the tomographic section are not visible because they are very blurred and out of focus. Production of each conventional tomographic slice required controlled, accurate movement of both the X-ray tube head and the film during the exposure, thereby making it different from all the routine radiographic techniques described in previous chapters. By varying the size of the X-ray beam and the type of the equipment movement employed, it proved possible to change the shape of the tomographic layer from a straight, linear line. As you can see here in figure 12.2, it is a linear tomograph in the coronal plane. The slice passes through and contains part of the antra and facial skeleton and shows an antral tumor to a curved and ultimately to the approximate horseshoe shape of the dental arch, providing an overall panoramic image of all the teeth and their supporting structures, the so-called dental panoramic tomograph or the DPT or panoramic radiograph. As you can see here in figure 12.3, a dental panoramic radiograph depicting a curved tomographic slice. The curved horseshoe-shaped slice is approximately the shape of the dental arch and contains the teeth and their supporting structures. In both examples, the tissues imaged in the tomographic slices are sharply defined and in focus, while the unwanted structure are burned out. So first, the conventional tomography. So conventional tomography it suffers from the collapsing of 3D structures onto the 2D image. So comparison with the computed tomography, it gives accurate diagnostic information about the distribution of structures inside the body. So a conventional X-ray image is basically a shadow. Shadows give you an incomplete picture of an object's shape. The computed tomography. Computed tomography is also known as CAT, or the CT scanning, or the computed axial tomography. Tomography is from the Greek word tomos, meaning slice or section, and graphia, meaning describing. Computed tomography is an examination that uses X-ray and computer to obtain a cross-sectional image of the human body. Computerized X-ray imaging procedure in which a narrow beam of X-rays is aimed at the patient and quickly rotated around the body, producing signals that are processed by the machine's computer to generate cross-sectional images or slices of the body. These slices are called tomographic images and contain more detailed information about the internal organs than conventional X-rays. What is a computed tomography or the CT scan? So the term computed tomography or CT refers to a computerized ray imaging procedure in which a narrow beam of X-rays is aimed at a patient and quickly rotated around the body, producing signals that are processed by the machine's computer to generate cross-sectional images or slices of the body. These slices are called tomographic images and contain more detailed information than conventional X-rays. Once a number of successive slices are collected by the machine's computer, they can be digitally stacked together to form a three-dimensional image of the patient that allows for easier identification and location of basic structures as well as possible tumors or abnormalities. So how does CT work. So, unlike a conventional X-ray, which uses a fixed X-ray tube, a CT scanner uses a motorized X-ray source that rotates around the circular opening of a donut-shaped structure called a gantry. During a CT scan, the patient lies on a bed that slowly moves through the gantry while the X-ray tube rotates around the patient, shooting arrow beams of X-rays through the body instead of film. CT scanners use special digital X-ray detectors which are located directly opposite the X-ray source. As the X-rays leave the patient, they are picked up by the detectors and transmitted to a computer. So each time the X-ray source completes one full rotation, the CT computer uses sophisticated mathematical techniques to construct a 2D image patient. So the thickness of the tissue in uh, images represented in image slice can vary depending on the CT machine used, but usually ranges from 1 to 10 millimeters. When a full slice is completed, the image is stored and the motorized bed is moved forward incrementally into the gantry. The X-ray scanning process is then repeated to produce another image slice. This process continues until the desired number of slices is collected. So, when would I get a CT scan? So, CT scans can be used to identify disease or injury within various regions of the body. For example, CT has become a useful screening tool for detecting possible tumors or lesions within the abdomen. A CT scan of the heart may be ordered when various types and heart disease or abnormalities are suspected. CT can also be used to image the head in order to locate injuries, tumors, clots leading to stroke, hemorrhage, and other conditions. It can image the lungs in order to reveal the presence of tumors, clots leading to stroke, hemorrhage, and other conditions. It can image the lungs in order to reveal the presence of tumors, pulmonary embolisms or the blood clots, the exist fluid, and other conditions such as emphysema or pneumonia. A CT scan is particularly useful when imaging complex bone fractures, severely eroded joints, or bone tumors since it usually produces more detail than would be possible with a conventional X-ray. So what is a CT contrast agent? As with all X-rays dense structures within the body, such as bone, they are easily imaged, whereas soft tissues vary in their ability to stop X-rays and thus may be faint or difficult to see. For this reason, intravenous contrast agents have been developed that are highly visible in an X-ray or CT scan and are safe to use in patients. Contrast agents contain substances that are better at stopping X-rays and thus are more visible on an X-ray image. For example, to examine the circulatory system, a contrast agent based on iodine is injected into the bloodstream to help illuminate blood vessels. This type of test is used to look for possible obstruction in blood vessels, including those in the heart. So, oral contrast agents such as barium-based compounds are used for imaging the digestive system, including the esophagus, stomach, and gastrointestinal tract. So, are there risks? CT scans can be diagnosed possible life-threatening conditions such as hemorrhage, blood clots, or cancer. An early diagnosis of these conditions could potentially be life-saving. So, however, CT scans use X-rays, and all X-rays produce ionizing radiation. Ionizing radiation has the potential to cause biological effects in living tissue. So, this is a risk that increases with the number of exposures added up over the life of an individual. However, the risk of developing cancer from radiation exposure is generally small. Magnetic resonance imaging, or the MRI. It uses a strong magnetic field and radio waves to create detailed images of the organs and tissues within the body. Since its invention, doctors and researchers continue to refine MRI techniques to assist in medical procedures and research. The development of MRI revolutionized medicine. What is an MRI, or the magnetic resonance imaging? So it is a test that uses powerful magnets, radio waves, and a computer to make detailed pictures of the inside of your body. So your doctor can use this test to diagnose you or to see how well you've responded to treatment. Unlike x-rays and computed tomographies or the CT scans, uh, MRIs don't use the damaging ionizing radiation of x-rays. So an MRI helps the doctor diagnose a disease or injury, and it can monitor how well you doing with the treatment. So MRIs can be done on different parts of your body. It's especially useful for looking at soft tissues and the nervous system. So an MRI of the brain and spinal cord can help find many things, including blood vessel damage, brain injury, cancer, multiple sclerosis or the MS, spinal cord injuries, stroke, eye problems, inner ear problems. So an MRI also of the heart and blood vessels looks for black blood vessels damage caused by a heart attack, heart disease, problems with the structure of the heart. So an MRI also of the bones and joints looks for bone infections, cancer, damage to joints, disc problems in spine, neck, or low back pain with nerve signs. So MRIs can also be done to check the health of these organs, like the breast, woman, liver, kidneys, ovaries in woman, pancreas, and prostate, the men. So a special kind of MRI called the functional MRI or the fMRI maps brain activity. So this test looks at blood flow in your brain to see which areas become active when you do certain tasks. So an fMRI can detect brain problems such as the effects of a stroke, or it can be used for brain mapping if you need brain surgery for epilepsy or tumors. Your doctor can use this test to plan your treatment. So risks of MRI. So pregnant women shouldn't get an MRI during their first trimester unless they absolutely need the test. The first trimester is when the baby's organs develop. You also shouldn't get contrast B when you're pregnant. So don't get contrast V dye if you've had an allergic reaction to it in the past or you have severe kidney disease. So certain people with metal inside their body can get this test, including those with some clips used to treat brain aneurysms, pacemakers, and cardiac defibrillators, and cochlear implants, certain metal coils placed in blood vessels. So MRI preparation. So before your MRI, let your doctor know if you have any health problems such as kidney or liver disease, recently had surgery, have any allergies to food or medicine, or if you have asthma and pregnant or might be pregnant. So no metal is allowed in the MRI room because the magnetic field in the machine can attract metal. Tell your doctor whether you have any metal-based devices that might cause problems during the test. So these include artificial heart valves, body piercings, cochlear implants, drug pumps, fillings, and other dental work, implanted nerve stimulator, insulin pump, metal fragments such as the bullet or shrapnel, metal joints or limbs, pacemaker or implantable cardioverter, defibrillator or the ICD, the pins or screws. So if you have tattoos, talk with your doctor. Some inks contain metal. On the day of the test, wear loose, comfortable clothing that doesn't have snaps or other metal fasteners. You might need to take off your own clothes and wear a gown during the test. Remove all of these before you go into the MRI room. So, like cell phone, coins, dentures, eyeglasses, hearing aids, case, underwire bra, watch, and also wig. So if you don't like enclosed spaces or you're nervous about the test, tell your doctor. You may be able to have an open MRI or get medicine to relax you before the test. Fast facts on MRI scanning. MRI scanning is a non-invasive and painless procedure. Raymond Damadian created the first MRI full-body scanner, which he nicknamed the Indomitable. The cost of a basic MRI scanner starts at $150,000 but can exceed several $1,000,000. Japan has the most MRI scanners per capita with 48 machines for every 100,000 citizens. Nuclear medicine, a medical specialty that uses radioactive tracers, radiopharmaceuticals, to assess bodily functions and to diagnose and treat disease. Diagnostic nuclear medicine relies heavily on imaging techniques that measure cellular function and physiology. So, what is nuclear medicine again? So, nuclear medicine is a specialized area of radiology that uses very small amounts of radioactive materials or radiopharmaceuticals to examine organ functions and structure. Nuclear medicine imaging is a combination of many different disciplines. These include chemistry, physics, mathematics, computer technology, and medicine. So, this branch of radiology is often used to help diagnose and treat abnormalities very early in the progression of a disease, such as thyroid cancer. So, because X-rays pass through soft tissue, such as intestines, muscles, and blood vessels, these tissues are difficult to visualize in a standard X-ray, unless a contrast agent is used. This allows the tissue to be seen more clearly. Nuclear imaging enables visualization of organ and tissue structure as well as function. So the extent to which a radiopharmaceutical is absorbed or taken up by a particular organ or tissue may indicate the level of function of the organ or tissue being studied. Thus, diagnostic X-rays are used primarily to study anatomy. Nuclear imaging is used to study organ and tissue function. So scans are used to diagnose many medical conditions and diseases. Some of the more common tests include the following. So first, the renal scans. Renal scans, these are used to examine the kidneys and to find any abnormalities. These include abnormal function or obstruction of the renal blood flow. So next, the thyroid scans. These are used to evaluate thyroid function or to better evaluate a thyroid nodule or mass. The third one is the bone scans. These are used to evaluate any degenerative and or arthritic changes in the joints, to find bone disease and tumors, and or to determine the cause of bone pain or inflammation. Next, the gallium scans. These are used to diagnose active infectious and or inflammatory diseases, tumors, and abscesses. Next, the heart scans. These are used to identify abnormal blood flow to the heart, to determine the extent of the damage of the heart muscle after a heart attack, and or to measure heart function. Brain scans. These are used to investigate problems within the brain and or in the blood circulation to the brain. Last but not the least, the breast scans. So these are often used in conjunction with mammograms to locate cancerous tissues in the breast. So how are nuclear medicine scans done? So as stated, nuclear medicine scans may be performed on many organs and tissues of the body. Each type of scan employs certain technology, radionuclides, and procedures. A nuclear medicine scan consists of three phases: the tracer or the radionuclide, the administration, taking images, and image interpretation. The amount of time between administration of the tracer and the taking of the images may range from a few moments to a few days. The time depends on the body tissue being examined and the tracer being used. Some scans are completed in minutes, while others may need the patient to return a few times over the course of several days. Ultrasonography, diagnostic imaging technique or therapeutic application of ultrasound. It is used to create an image of internal body structures such as tendons, muscles, joints, blood vessels, and internal organs. Its aim is often to find the source of a disease or to exclude pathology. Ultrasonography uses high-frequency sound ultrasound waves to produce images of internal organs and other tissues. It is a device called a transducer, converts electrical current into sound waves, which are sent into the body's tissues. Sound waves bounce off structures in the body and are reflected back to the transducer, which converts the waves into electrical signals. A computer converts the pattern of electrical signals into an image, so which is displayed on a monitor and recorded as a digital computer image. So no X-rays are used, so there is no radiation exposure during an ultrasonography. Shallography. Shallography is the radiographic examination of the salivary glands. It usually involves the injection of a small amount of contrast medium into the salivary duct of a single gland, followed by routine X-ray projections. The resulting image is called a shallogram. Shallography is the imaging of the salivary glands, most commonly the parotid gland. The salivary ducts are conventionally examined fluoroscopically with high sensitivity, though cross-sectional imaging with CT or MR shallography has also been described. So its indications: it's suspected shallow lithiasis or salivary duct obstruction, suspected adenitis to identify ductal structures, and suspected shalactasis in chronic inflammatory disorders and autoimmune diseases. So there are types of shallography. So there are three types. First, the conventional or the fluoroscopic shallography with or without digital subtraction. Second, the CT shallography or the ultrafast technique. So next, the third one is the MR shallography. So in most cases, ultrasound with shallography, if required, it is an appropriate imaging modality for the investigation of ductal pathology. In cases of shallow lithiasis, ultrasound of the parotid glands is a useful, readily available, and non-invasive, and also an expensive option. So the technique of CT shallography. So the procedure is essentially the same as a conventional shallogram, after which the patient is positioned in a CT in a neutral supine position. Multiplanar data acquisition allows for 3D reconstruction. Intravenous contrast material can be administered for better soft tissue evaluation, especially for parotid masses. In the 1970s and 1980s, when this technique was first introduced, slower CT scans called for delayed ductal emptying, for which atropine was given. So there is advantages and disadvantages. So its advantages is assessment of glands other than the parotid is possible, better diagnosis of parenchymal pathology, excellent visualization of deep lobe, and better subtraction options, and no special positioning required. And its disadvantages are intravenous atropine is required to minimize runoff of contrast and impair ductal clearance in some cases, and radiation exposure. Next, the invasive procedure. Cone beam computed tomography. It is a radiographic imaging method that allows accurate three-dimensional imaging of hard tissue structures. The CBCT is the most significant among the medical diagnostic imaging modalities that have emerged recently. So what is cone beam CT and dental? So dental cone beam computed tomography, or the CT, is a special type of X-ray machine used in situations where regular dental or facial X-rays are not sufficient. It is used routinely because the radiation exposure from this scanner is significantly more than regular. So dental X-rays, these types of CT scanner uses special type of technology to generate three-dimensional 3D images of dental structures, soft tissues, nerve paths, and bone in the craniofacial region in a single scan. Images obtained with cone beam CT allow for more precise treatment planning. So cone beam CT is not the same as conventional CT. So, however, dental cone beam CT can be used to produce images that are similar to those produced by conventional CT imaging. So, with cone beam CT, an X-ray beam in the shape of cone is moved around the patient to produce a large number of images, also called views. CT scans in cone beam CT both produced high-quality images. So, in dental cone beam CT, it was developed as a means of producing similar types of images, but with a much smaller and less expensive machine that could be placed in an outpatient office. Cone beam CT provides detailed images of the bone and is performed to evaluate diseases of the jaw, dentition, bony structures of the face, and nasal cavity and sinuses. It does not provide the full diagnostic information available with conventional CT, particularly in evaluation of soft tissue structures such as muscles, lymph nodes, glands, and nerves. So, however, cone beam CT has the advantage of lower radiation exposure compared to conventional CT. So, there are some common uses of the procedure. So, dental cone, here in dental cone beam CT, it is commonly used for treatment planning of orthodontic issues. It is also useful for more complex cases that involve surgical planning for impacted teeth, diagnosing temporomandibular joint disorder, the TMJ, accurate placement of dental implants, evaluation of the jaw, sinuses, nerve, canals, and nasal cavity, detecting, measuring, and treating jaw tumors, determining bone structure and tooth orientation, locating the origin of pain or pathology, cephalometric analysis, and lastly, the reconstructive surgery.